Okay, ladies, thank you for your patience as I have just returned from my think break and I thought about our discussion and thought about the progress that you have made in a short time. I want to say that you two coming in here with the situation that you presented is very commendable. Um, we deal with blended families all the time. Um, there was no judgment placed as you all were talking because the situation, Linda, as you described, created some hurt in you, and you were able to um, kind of gain some closure. It seems like with Sarah apologizing, and you guys see what you need to do to move forward. So, and the ultimate goal was to communicate better so that the children can grow up together. Okay. Um, communication is not having proper communication is not a foreign thing. It happens as the stresses of raising children and working can create those stresses. And so it's good that you all came in to work on those things. Okay. Um, I give you all credit for also not allowing the children to be torn apart by how the families were developed. So that's really great because you all recognize that this can be detrimental for their development. And y'all both stated that you would not badmouth each other anymore, especially in front of the children, and that you will schedule times to get together and just really work together. So I think that that is really great. Um, there's a parenting maybe considered kind of like co-parenting or blended family. There's an excellent website and also an on-site facility that helps to help families to continue to build on their communication skills. If you guys are interested in that, my assistant can sign you up. I really suggest that you do that as you move forward with this newfound progress. Okay. Um, as this situation can be quite stressful. You were once married and no longer married, and now raising these teenage boys on your own. So it is definitely um, normal for you to have the feelings that you have, and it's definitely normal for you to have felt that she feels some kind of way towards you because of the way things turned out. But now that it's all resolved and you guys are on your way to communicating better, um, as you leave here on track to communicating better, what will you be saying um, to yourself differently about Linda or about your communication?
Um, first thing you said, what would I be saying to myself? Her name is Linda. She deserves to be respected, is what I say to myself. Then you said, what can I do differently?
Yeah, what would you be doing differently in your communication with Linda?
I would monitor what I say and how I say it, and package it so that she can receive it. Um, making sure it's appropriate and it's not demeaning and it's respectful.
Okay, great. Linda, same question. What would you be saying differently about your communication with Sarah?
Well, I will present myself respectful to her, and not, name call. Need to let the past be the past. And like she was saying, move forward. Because all those arguments and all that we had didn't mean anything. Name calling, all of that. I think we too old for that. Now that I think about it, I know I'm too old. So I just need to let it go. Um, show her the respect that she deserves and the respect that Larry deserves, and realize it's for the kids. So,
Okay. Now, once the communication is where y'all want it to be, what would you be doing differently with Sarah?
Maybe we can, go out or something, catch a movie. It's, I'll leave that invitation open for her. If she would like to, see a movie or whatever. That's fine with me.
Okay, great. Sounds like, the beginnings of something great if you are open to building something with her even further, just past the kids' foster relationship. Okay, so, we're almost done, and so, to move forward even further, I want you to observe more positive in your communication with Sarah, okay? I want you to take note, even when you're communicating about difficult things, how you're responding to each other. I also want you to observe it, look for those exceptions, even when, um, it's not such a pleasant, you not had such a pleasant day, or you may be still mad with your children's father, how you still communicate with Sarah, how you guys still make it happen for the children to, um, hang out and grow up together, because that was the ultimate goal, is improving the communication so the kids can grow up together. Okay, you gotta understand the positives and the exceptions.
Mm, I think so.
Well, Claire, can you explain a little bit the exceptions?
Okay, those exceptions are those times, because we're on our way. We're on our way to improving. We're not looking back at the name calling. We're not looking back on her leaving you on the doorstep, and we're not looking at that. We're gonna move forward. And just by some chance that she may have a lapse where her mind may take her back there, and she may still feel that hurt. I want you to pay attention to how you communicate and what you did to bring it back to where you're trying to go. Because sometimes hurt doesn't just go away. It can sometimes, remanifest. Anything can cause it to resurface. And so those are those exceptions, because we're not looking back, but just by some chance it comes back up. Pay attention to how you guys communicated, and those in particular, what helped to get it back on track, because those are the things that you need to focus on to keep moving forward. Okay, you understand the exceptions now? Okay. Um, anyone have any questions? Because we're gonna sign you up. I strongly suggest that you all do the blended family classes online and on site, as, you all are on your way to building something great. My sister will sign you up if you're, per my suggestion, I really would like for y'all to do that. Do you have any other questions, in regard to?
I do.
Okay.
At the very beginning, you said this is module
This solution focused therapy is a brief treatment modality.
modality. What does that mean?
It's just a way, there are different treatment modalities that different therapists use to help, our patients with their problems or issues. And it's just a way of treatment, it's just a mode of treatment.
Oh, okay.
There are many others, one being CBT, one being psychotherapy, but I choose to employ, solution focus, because it's brief. It's not one that's long drawn out, where patients constantly sit and think and are in the moment of their problems, that keeps them in the rut or whatever. So we focus more on moving forward, and that's why, ladies, you're on your way to doing exactly that. And so, I think this is the best, treatment modality for you all, and, I see and hope to hear great things about those children growing up, and, that your communication, y'all even hung out together. Look forward to hearing about that.
Right.
Okay, so any other questions that you, need for me to answer before we close out the session?
I have one more.
Okay.
Um, okay. You said this is brief,
Yes.
but then you said you hope to hear back from us.
Okay.
So, does that mean we have to keep coming back?
No, that's in the event that you need me.
Okay.
Let me clarify that. In the event that you need me, because you still need a little help, you can come back and we talk about it, and we come up with more solutions, okay? In the event that you need me for something else, another problem, you can come see me. So
Okay.
if you use this treatment modality, how you see fit. So you can just keep me updated on, oh, it worked, you can, hey, just, we do a follow-up call, and in our follow-up call, you can just let us know, how things are going. So, you just use it at your own leisure. You can come in and just come talk about things that are, concerning you. So, we're just here at your leisure. We just really are, solution focused, practice here where we really just help individuals to achieve their goals. And so that's why I left the door open. And I just want you to know, even outside of here, I support your goal attainment. Okay. Linda, any questions? Okay, ladies, I would like to thank you all for coming out, and I wish you well, you and your families for the
Okay.
future. Okay, thank you.
Thank you.